look into a pregnancy medical checkup. So each time you come to visit a doctor, what are we going to do from the start of your pregnancy till the end of the pregnancy, so that you have a clarity of like what is going to happen next to you. So let me start the pre-pregnancy counseling. Let's not start with after pregnancy immediately. So let's start about even before you get pregnant, you have to do certain things. No, don't jump into getting pregnant immediately. There's something called pre-pregnancy counseling. So pre-pregnancy, what you will be discussing with the doctor and what would the doctor expect you to do is you will have to be in your ideal weight. So if you're obese, please try to control your weight, lose some weight before you try for a pregnancy, because obesity is something which will lead you into other medical problems during pregnancy. So definitely controlling your weight gain, keeping you in your ideal weight, then planning for pregnancy is very, very important. And avoiding certain habits like smoking, alcohol, drug abuse, these things should be avoided or completely stopped before even you plan for a pregnancy. Third will be meeting the doctor, having a general checkup done to see whether everything is fine with you. Like you can have a scan done, you can have a blood test done where you screen your hormones like thyroid, prolactin, and other renal function test, everything, so that you don't end up having a surprise after getting pregnant. If you're already having a medical problem, like you're a hypertensive, you already have a thyroid disorder, or you already have a diabetes, your diabetes should be under control before you plan for a pregnancy. So diabetes, HbA1c of less than 6 is definitely mandatory to get pregnant, and your blood pressure should be very normal. You should be taking your regular medications regularly. Your thyroid should be under control to get pregnant. And also discuss with the doctor about your family disorders. If there is any disorder, you should also know how much there is chance for you to have a baby with the same disorder. So there are certain pre-implantation genetics. There are some screening genetic tests which can be done for the couple even before you plan for a pregnancy, and certain disorders can be avoided from getting into the offspring. So much is important or needed to be done during the preconception period itself. There are certain supplements which can be given to you, like preconceptional folic acid is mandatory at least 2 or 3 months prior to your pregnancy, so that the baby formation happens properly and the baby formed will have a proper neural tube and a brain development which is happening. And there is a bit of prevention of Down syndrome when you take preconceptional folic acid. So coming on to what we do after conception. So once you confirm your pregnancy with your preg card or a blood test, you schedule a meeting with your doctor immediately. There are family members who say, wait for 45 days, wait for 80 days. Why do you have to meet the doctor immediately? Don't go do too many tests. Scans are dangerous. These are certain myths which are being discussed in the family. Scan and ultrasound is not a danger. Ultrasound is quite safer for you and for the baby. It doesn't have any harmful radiation which is coming out. So don't worry about the ultrasound scan which is being done in the initial part. So once you meet the doctor, you make sure you're very comfortable, clarify all the questions, talk about your diet, talk about your weight gain which is needed during the pregnancy. So if you're little overweight, the entire pregnancy you might require only a 5 or 6 kg of weight gain. If your BMI is very high, it is only 5 kg which is needed for the entire 10 months. And if you're very lean, probably there is an extra limitation of weight gain given to you. That is up to 10 to 12 kgs you can gain. A normal woman, somewhere between 5 to 10 kgs of weight gain is enough. So there is a myth that everybody who's getting pregnant should gain weight too, so that the baby also gains weight and your weight gain is proportionate with the baby's weight gain. It is not like that. All we need you to do is a proper diet and maintain your fitness and continue to do your exercises. So weight gain is not a good indicator of health. Weight gain is actually a bad indicator of health. Probably you discuss about, the doctor will let you know, confirm your pregnancy through an ultrasound and will let you know whether the baby has formed inside the uterus, or sometimes it can be formed outside the uterus also, which is not a good condition. So those things has to be cleared in the first consultation itself. The second will be your dating scan, which is the first scan which is officially done where you will be given a report. Why do we do a dating scan? To just confirm your pregnancy. We measure the baby and exactly fix your delivery date, which is again very important. And during the dating scan, you will be allowed to do some blood tests to see whether there is any hormonal changes which are happening due to pregnancy itself. There could be a change in your hemoglobin, there could be a change in your sugar levels or the thyroid levels. So those have to be checked, and also we screen you for certain infections like HIV, BCG, that is jaundice and rubella. So those kind of general blood tests has to be done. And also we look into your sugar levels and thyroid levels. Preconceptional itself, there are certain vaccines which can be taken, like rubella vaccine. If you're not taken, probably that has to be given in the preconception counseling period itself. Next, we go to the first level of screening scan at the 12 to 13 weeks. We do the first screening scan, that is called level 1 scan. So this is the time where we are exactly going to check the organ developments of the baby and to see whether baby is forming fine, whether there is any defective formation of the baby. So this is very, very important, because by 11 to 13 weeks itself, if we can identify whether baby is healthy or unhealthy, there is a chance that we can stop that pregnancy in a very comfortable way. If the baby is going to be completely fine, we are all happy and we can move forward. So that is a level 1 scan, and it's called combined test, where we do NT, that is nuchal translucency scan, and along with the NT scan we do a double marker test. So double marker test is a blood test which is drawn from the mother to check certain hormones, which will give us an idea whether genetically the baby is fine, whether baby has any Down syndrome, whether baby has any other syndrome which is related to, which will be dangerous for the baby. So after we cross this, we will do there will be a monthly checkup during this period, and each time you come to meet the doctor for a monthly checkup, there could be a blood test or there could be a scan being done, and each time we will definitely measure your weight, we will be measuring your blood pressure, also we will be giving you a dietary counseling, and also we will be monitoring your weight gain, and we will examine the baby as well. 20th week onwards, that is the 5th month, we will be doing the level 2 scan. So level 2 scan is similar to the first level 1 scan, but here the baby's organs would have grown well and would have reached the stage of completion. So when the organs are grown fully full and then it's come to a completion, this is when we check for all the organs that is available, like whether the liver is there, kidney is there, whether 2 kidneys are there, whether there is a bladder, whether the legs are formed well, whether the arms are formed well, whether there is 5 fingers, everything, the position of the leg of the baby. Sometimes the leg of the baby can be turned or inwardly rotated. So many things are being checked in this level 2 scan. Even minute organs like the heart, the valves, and everything inside the heart, everything is being checked during this level 2 scan. So even a minute structure has been completely analyzed by the doctors, and this is done by only specialized doctors called the fetal medicine doctors, not done by anybody else, because these people have studied only for this and they are trained to detect any small change which has happened to the baby even in a simpler way. 24 weeks we will do the GTT test, a routine blood test or screening test, which is done for all the women to screen them for diabetes. So GTT is a blood test which is done after giving a 75 grams of glucose to you to drink, after which we will be testing you twice, that is, one is fasting, then after giving the glucose we will draw your blood twice, that is 1 hour and 2 hours, and then we will be assessing you whether you are getting into diabetes or not. After 24 weeks, at 28 weeks we meet you for a growth scan, because after 20 weeks we have not done a scan at all. 28 weeks we will be assessing the weight of the baby, the blood flow from mother to baby, to see whether everything is going fine. After 28 weeks, it will be a bi-monthly visit, it will not be monthly visit, where we are going to meet you frequently to see whether the baby's growth is fine, whether your blood pressure is fine, whether your weight gain is good. Everything has to be assessed every 2 weeks. And if there is a requirement, we will repeat the scan by 34 to 35 weeks. And if there is a requirement, we might also repeat the scan by nearing your due date if you're not getting into labor at the right time. So these are the few things which we will be following you up with during the entire pregnancy process of 40 weeks.